Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
So the question is what high or low antibodies mean in terms of Hashimoto's thyroid symptoms. This is a great question. It's a question I have gotten a zillion times. It's not actually a question I've gotten a zillion times. Basically what happens is this person comes in with their labs and then they're opining or agonizing over whether their antibodies have gone up, whether they've gone down. My antibodies won't come down. I got to get my antibodies down. And none of that is exactly, well, it's not correct at all. So here's kind of the skinny on antibodies. So antibodies are made by your system to alert your immune system to attack something that's bad, like a virus or something like that. And then unfortunately for a lot of us, we have the genetics that say that once you've developed a certain trigger and your immune system flares up, your immune system might look around and go, oh, that person's genetics say I can attack their thyroid tissue. Okay. Now there's, and this is interesting because everybody talks about the thyroid peroxidase antibodies. So there's two different types of antibodies. There's an anti-thyroid globulin antibody, which almost nobody ever talks about. And then there's the thyroid peroxidase antibody, the infamous TPO. And so these antibodies are attacked, these antibodies when a trigger is introduced into the system, a food or a toxin or a stress or you over-exercise or whatever your triggers are, okay? Then this trigger will set off an immune response, and then that immune response will cause the antibodies to go up because you have the genetic propensity and your antibodies have been tagged by your immune system. So now every time your immune system goes up, your thyroid antibodies will go up, and then that will call your white blood cells to come and attack. Okay. And so basically the antibodies, I've had people come in here with antibodies of 20,000 or more. Now the range is 0 to 9. And for those of you who say it's 0 to 32 and 0 to 64 and 0 to 60 and all that, it's not, it's 0 to 9. Okay. And if if somebody comes in here and they got antibodies of 20,000, they're freaked out of their minds. Oh my God, they might be sitting there and not even feel that bad. Maybe their only symptoms are that they get occasional heart palpitations for no reason at all, and they got the hypothyroid symptoms of being overweight and their hair's falling out, so, which has nothing to do with their antibodies. It has to do with them being hypothyroid because their thyroid's been beaten up and it's not working well. And so there's not a correlation really between numbers of antibodies. Why is it different for everybody? Everybody has different immune systems. Everybody has different plasticity of their immune system. In other words, everybody, so whose immune system is on a hair trigger, who's not, whose microbiome is working properly, and whose microbiome is not working properly, and who's in a chronic stress response or PTSD. All these factors factor into where your antibody levels are. The better approach to understanding antibodies is to the first couple of times you get your antibodies taken, let's just say they're at whatever. Let's just say they're at 500. Okay, say the antibodies are 500. Probably to some degree, it's useful to use that as a baseline for you. And maybe your antibodies are going to go up and down as you get better or not, but they're not. And you might be able to use that as a baseline and go, you know, I think your antibodies are 500 and now they're down to 350, and so it shows that what we're doing is working. But it's not a reflection of how much tissue damage you have. The reflection of how much tissue damage you have is the old-fashioned thyroid stimulating hormone marker, the TSH. That's what tells you if there's damage. If your TSH starts out at 8 and then you go to the doctor and they give you medication, or you go to us and you get all the other things fixed, and your thyroid and your thyroid goes, your thyroid antibodies stay the same, but your TSH goes to normal, you're in good shape. If you are taking thyroid medication and you go to the doctor, you should go once a year if you have autoimmune thyroid disease, once you've got an established baseline, and your TSH keeps going up, they have to keep giving you more. Like, I started off with 25 micrograms of medication, now I got to give you 50, now I got to give you 75. Your thyroid's being damaged. You're missing a lot. Whether you're experiencing a lot of symptoms or not, your thyroid's getting damaged. If your thyroid's getting damaged, you're missing triggers. So really, that's a better way of assessing your thyroid than looking at the antibodies. Your thyroid antibodies going up and down, you could almost argue means nothing other than the fact that you have autoimmune thyroid disease. So, and there's so many things that can cause it on a certain day. You can be stressed and your thyroid antibodies can go up. Doesn't mean you're getting more attacked. It doesn't mean any of that. It just means that, well, I honestly, once I've seen the antibodies once on a person, if their antibodies are like 75, I'm like, you have Hashimoto's. That's the last time I ever test them. I never even test them again. It doesn't matter. It really has no effect on whether they get better. But I test TSH, I test their T3, their free T3, their T4, their T3 uptake. I test those all the time, because those are the ones that are going to tell you how you're doing once you start eliminating the triggers. So that's kind of the answer on antibodies.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.